After being exposed to the herbicide paraquat while serving in the Vietnam War, a 58-year-old man developed Parkinson's disease years later. He was treated with standard L-Dopa therapy and other drugs to relieve tremor. All therapies failed, so he received intravenous glutathione, which gave only temporary relief before failing also. Glutathione is a super antioxidant which is needed for cellular protection, proper mitochondrial function, and proper immune function. It eliminates free radicals that oxidize our cells. Cellular oxidation is essentially biological rusting, like watching an old automobile slowly rust, and free radicals are responsible for cellular oxidation. Free radicals are organic molecules responsible for aging, tissue damage, and possibly some diseases. Free radicals are unstable and look to bond with other molecules, thereby destroying their health and further continuing the damaging process. Words related to free radicals include oxidation, oxidative stress, reactive oxygen species, reactive nitrogen species, free hydroxyl radicals, peroxidation, peroxide, hydrogen peroxide, lipid peroxidation. Free radical scavenging enzymes include catalase, superoxide dismutase, glutathione peroxidase. Anytime you hear any of these words, think biological rusting. After failed drug therapy, the 58-year-old man rejected deep brain stimulation as recommended by his neurologist and opted for treatment from a company called Neuro Research. At Neuro Research, they first determined his amino acid deficiencies and placed him on a therapy program of non-prescription supplements, with the goal of balancing the neurotransmitters dopamine and serotonin, while replenishing his sulfur amino acids. Restoring sulfur amino acids to their normal levels helps the body to naturally produce the antioxidant, glutathione. L-Dopa, the combination of levodopa and carbidopa, is difficult to simultaneously administer with the amino acids tyrosine and tryptophan because L-Dopa competes with tyrosine and tryptophan for brain uptake. Therapy at Neuro Research includes tyrosine and a natural source of levodopa. The source of the amino acid levodopa is derived from the mucuna pruriens vine, also known as the velvet bean. Mucuna pruriens is used as therapy for Parkinson's disease in Indian medicine. In addition to 40% levodopa, the mucuna pruriens compound is composed of nicotine, 5-HTP, and alkaloids. Eight people participated in a randomized controlled double-blind crossover trial comparing L-Dopa and mucuna pruriens as therapy for Parkinson's disease. The rapid onset of action and longer on time without concomitant increase in dyskinesias, a mucuna seed powder formulation, suggests that this natural source of L-Dopa might possess advantages over conventional L-Dopa preparations in the long-term management of Parkinson's disease. Anti-Parkinson botanical mucuna pruriens prevents levodopa-induced plasmid and genomic DNA damage. In vitro experiments have shown that in the presence of divalent copper ions, levodopa may induce DNA damage. Mucuna pruriens cotyledon powder protected both plasmid DNA and genomic DNA against levodopa and divalent copper-induced DNA strand scission and damage. In a case study, a Parkinson's patient was treated with mucuna pruriens for 12 years, and it slowed the progression of Parkinson's without the side effects of pharmaceutical L-Dopa. In a multi-center clinical trial, 60 Parkinson's patients, 26 of whom were previously treated with L-Dopa, and 34 untreated patients were given mucuna pruriens as therapy for 12 weeks. and there were statistically significant reductions of Parkinson's symptoms in all studied patients. Scientists at the Buck Institute for Research on Aging induced Parkinsonism in monkeys with MPTP and then treated them with either Sinemet, the combination of levodopa carbidopa, or mucuna pruriens endocarp powder and carbidopa. Sinemet treatment significantly increased substantia nigra reticulata bursting firing patterns, which are associated with levodopa-induced dyskinesias. This effect was absent with mucuna pruriens therapy. The distinctive neurophysiological findings in the basal ganglia and the ability to ameliorate Parkinsonism without causing dyskinesias strongly suggest that mucuna pruriens acts through a novel mechanism that is different from that of levodopa. Patent number 7470441 is an invention that relates to the use of mucuna pruriens seeds for the preparation of a pharmacological composition for the treatment of Parkinson's disease. These results suggest that the neuroprotective and neurorescue effect of mucuna pruriens may be related to its antioxidant activity independent of the symptomatic effect. In addition, the drug appears to be therapeutically safe in the treatment of patients with Parkinson's disease. Tryptophan deficiency is common to Parkinson's disease, as noted in the articles. Effects of acute tryptophan depletion on neuropsychological and motor functions in Parkinson's disease. Altered tryptophan metabolism in Parkinson's disease, a possible novel therapeutic approach. 2 female Parkinsonian patients with levodopa-induced on-off responded dramatically to administration of L-tryptophan supplementation. From the Neuroresearch abstract. As noted in the literature, administration of only L-dopa or improperly balanced L-dopa further depletes tryptophan. The amino acid tryptophan is converted into 5-HTP, and 5-HTP is converted into serotonin in the brain. Mucuna pruriens, 5-HTP, tyrosine, and tryptophan are all part of daily therapy. After 4 months he had dramatic improvement in his tremor. He regained coordination in his left hand and was once again able to use the keyboard. He resumed his hobby of playing the guitar and was able to perform proficiently. His depression improved significantly. His anxiety was significantly relieved, and he lost his fear of going out in public. In the 2 years since initiation of treatment, the patient has continuously maintained the benefit of the treatment, with no surgical intervention as previously recommended by his neurologist, and no prescription medications.